7:05 by my time. I think we are 5 minutes behind time. So can we have a word of prayer and start out? James, if you can assist us with a short prayer.
Okay, let us pray. Father, we thank you so much for bringing us together for this important webinar. And we pray that please can be in our midst and help us in all our discussions. In Jesus' name we pray. Amen.
Amen. Thank you very much. Good evening once again, and you are all welcome to this evening's webinar. By way of introduction, my name is Kojo Enim. I'm the Vice President for our association, and I'll be stepping into the big shoes of Dr. Akongo, who unfortunately is unavailable right now in another engagement. He extends his apologies to all of us. Today is World Malaria Day, 25th of April, and the world commemorates this day with a theme, accelerating the fight against malaria for a more equitable world. Our webinar this evening is titled, Zero Malaria Starts With Me. It simply means we all have a contribution to the elimination of malaria. In our country, several institutions stand tall in the fight to achieve malaria elimination. And one of the key ones is Anglo-Gold Ashanti Ghana Malaria Control. I believe most of us, if not all, have heard of this name. Today, we will listen and hear how they have been supporting such a venture to help in the statements that we just made, in trying as much as possible to eliminate malaria, and how we all can contribute in achieving the national targets together. Their theme, that is AGA Malaria Control, their theme, small actions, big impacts. Through that, they have carved a niche for themselves. The speaker for our webinar is no other person than the Executive Director of Anglo-Gold Ashanti Ghana Malaria Control, who is also a member of our association, Mr. Samuel Esiedu. He is a public health specialist with a social marketing, management, and economics background. Samuel has extensive experience designing and managing malaria programs across sub-Saharan Africa, including his recent experience in mining communities. As I mentioned earlier, he's the Executive Director of Anglo-Gold Ashanti Ghana Malaria Control, in short, AGAMAL. AGAMAL is a non-profit subsidiary of Anglo-Gold Ashanti Ghana with a mandate to plan and execute efficient, effective, and responsive public health interventions in Ghana and beyond. I'm sure when we listen to him speak, we will know the scope for the organization that he oversees. He oversees the implementation of the Global Fund Indoor Residual Spraying IRS program in Ghana, which covers 16 administrative districts. The IRS intervention, as we all know, extends to protect all prison inmates in Ghana as well. His recent work also involves advocating for the active involvement of the private sector in malaria elimination. I sometimes feel I'm too small to introduce him. So shall we welcome Samuel Esiedu to be the speaker for the webinar for this evening. Sam, over to you.
Thank you, Dr. Kojo Enim. I really appreciate this and for the kind words spoken about me. And good evening to everyone. Thank you once again for the opportunity given me to have this webinar. Let me try sharing my screen and we will pick it up from there. I hope my screen can be seen.
Yes, we can see.
Right. So as Dr. Enim said, today is World Malaria Day. It's a day set aside for us to commemorate all the activities and to celebrate the successes that we've chalked so far, and also to review and reflect all the interventions, all the things that we are doing and creating a future for ourselves. Tonight, we have opportunity to also hear what Anglo God Ashanti has invested into malaria prevention or towards elimination in Ghana. So for the background, I would say as public health people, we all know that malaria is a life-threatening disease spread to human by the female Anopheles mosquito. Malaria is preventable and it's also curable, and yet it has devastating effects to our generation and the generations past. According to the World Health Organization, in 2022, they estimated globally we recorded 249 million malaria cases and also recorded around 608,000 deaths in malaria, for which Africa contributed 95% to these death cases, and children under 5 years accounted for about 80% of all the malaria death in Africa. So we can see the effect of malaria on our continent and how it is taking away lives. Despite these sobering statistics, the global fight against malaria has made significant strides in recent years. In the last 22 years, malaria incidence has reduced by 36%, and the mortality has also decreased by 47%. Ghana is among the 15 highest burden malaria countries in the world, and Ghana contributes to 2.2% of the global malaria burden. The fight against malaria in Ghana has also seen some notable achievements. In 2023, malaria cases estimation for Ghana was 4.8 million, and the previous years was 5.1 million. Furthermore, the country has witnessed a decline in malaria-related death, with children under 5 now accounting for about 62% of the 120 malaria-related deaths in 2003. The previous years, children under 5 years accounted for 80% of the total malaria death. These positive trends are a testament to the concerted effort of the National Malaria Elimination Program and the contributions of organizations such as Anglo God Ashanti Malaria Control. Since our inception in 2005, AGAMA has been conducting indoor residual spraying in Obuasi and beyond, helping to reduce the burden of malaria in our country. Today's presentation will provide an overview of what AGAMAL has been doing, emphasizing on its scope and outcome and the positive impact it has made, and a focus will also be placed on what each and every one of us can play to achieve a zero malaria agenda for Ghana.
Oh, sir. Effective date of was
in 2004. It all began in 2004 when Anglo God Ashanti submitted its operational report to stakeholders and identified malaria as a threat to its operation, not only in Ghana, but the whole of sub-Saharan Africa. That includes Ghana, Mali, Guinea, and Tanzania, where they have operations. So based on that, the man decided to do something about that. The motive of the intervention that the mine created was to get committed to maximizing productivity and contribute to a broader corporate social responsibility strategy that creates a positive social license for the organization to operate. And it is related to its core values. As I pick from the extract from the value statement of the organization, it states that the Anglo-Good Ashanti strive to form a partnership with the host community, sharing their environment, traditions, and values. And we want communities to be better off for Anglo-Good Ashanti having been there. So if Anglo-Good Ashanti has been or has operated in a community, they want to ensure that before they leave, community members are much more better off for Anglo-Good Ashanti having been present. So how did the malaria program start? The mine established what we used to call the Boise Malaria Control Program, OMCP, because it's identified the shortfalls with staff health. It was affecting productivity and causing loss of time and days off, and families and individuals were getting sick. Before 2005, the mine hospital was recording 6,800 malaria cases each month, out of which about 2,500 were mine workers. And for every worker that get a bout of malaria, the person is given 3 days off. And with this figure, you realize that about 7,500 lost man shift hours were recorded every month, and that actually affects productivity. Even with that, when the person comes back to work, you know how malaria is. You don't have your full strength and you are a bit slow at work. So productivity actually decreased. In addition to all this, the mine was also spending a whole lot of money for treatment, in treating malaria for its staff. It spends around 660,000 per annum in USD for treatments. So in 2005, the mine implemented an integrated malaria control program, not only for its staff, but to cover the entire municipality and Obuasi East as well, with indoor residual spraying as a mainstay. This slide shows pictures of what actually happened. The mine had dedicated offices and laboratories. And as it started, we had the former president, Kufuor, as the president at that time. The top middle picture shows the president in a handshake with the then executive director for Agama. There was a well-equipped laboratory that was set up to make it a first-class organization that has a mandate to work on malaria. The implementation framework of the program had a couple of components, one of which was the main vector control, which included indoor residual spraying, larval source management, and some area spraying as well. There was a strong social and behavioral change communication that did a lot of education and awareness creation in the community. And also for those who could afford, educated them on how important it is to do the house screening. There was this other component on complementary interventions such as entomological and epidemiological monitoring that helped us to base the entire intervention on science. And then there was some components on improving malaria education and awareness and education with the mine workers. So this is how it works. IRS is the application of a long-lasting residual insecticide to the potential malaria vector resting surfaces, such as the internal walls, eaves, and ceilings of our homes and various structures. And in doing that, mosquitoes, we know they predominantly want to feed inside and rest inside. So when the walls are treated, any mosquito that gets into the room to rest on the wall will pick a lethal dose of the insecticide, and that will knock it off. Either kill it instantly, or sometimes it takes a couple of days. But as it has taken the lethal dose, it also prevents it from feeding and also going out to the water to go and lay eggs. So upon contact with the treated surface, the insecticide kills them, reducing their ability to transmit the disease. The initial objective set by the campaign was to reduce malaria incidence by 50% in the first 2 years. However, the program became very successful, and in the first 2 years, they were able to reduce malaria incidence by 74%, according to the records that we have from the Mine Hospital. In the first year of implementation, we had 2 rounds of spraying because the residual efficacy of the insecticide could last for 4 months. So we did 2 rounds of spraying, and each round of spraying was done just before the main raining season. According to the science, you must deposit the insecticide on the wall just before the rain starts, so that when mosquitoes start breeding and their volume starts increasing, in trying to get a blood meal, they will stay on the wall and pick a lethal dose, and that will kill them. So the first round was done around February, and the second round was done around August. You know, we are in the forest zone, and we have 2 major rainy seasons. The third round was done again between January and February. Around January and February the following year, that was in 2007. And then the 4th round was done almost at the peak of the rainy season. And at the end of the 4 rounds, we then recognized that malaria reported cases at the health facility had reduced by 74%. How did we move on from malaria control program to AGAMA? So with this success story, it was introduced again to NMEP, and NMEP, with their effort, also made the introduction to the country coordinating mechanism at that time to seek for external funding in order to expand the program. So the Global Fund approved a total grant of 133 million USD in 2008 in order to scale up IRS to 40 districts in Ghana by 2015. And this implied that the country coordinating mechanism select AngloGold Ashanti as a principal recipient of the grant. But we all know that AngloGold Ashanti is a business entity and is not eligible to receive funding from the Global Fund. And therefore, the entity had a division, or let me call what we call the Sustainable Development Unit, which is a non-profit but solely owned by AngloGold Ashanti in order to receive these grants. So they created what we call AGAMA, which has its own board separated from the main organization, that's the mother company, AngloGold Ashanti. So in 2014, there was this reprioritization of funds from the Global Fund. And therefore, with that, the country needed to scale down from the 40 expected districts to about 13 districts in which we needed to do the intervention. In 2017, we had Engine IRS projects from IVCC, which came in to also support with the payment of, do the co-funding for insecticide. And that gave us a little bit of room with the amount of money that we got from the Global Fund for program implementation. And therefore we extended it to 3 more districts in Upper East. In 2018, there was an expansion of the program up to now to cover all prisons in Ghana. And therefore, currently, we are still spraying all the 46 prison sites that we have in Ghana. I must add that when the program was expanding beyond Obuasi, IRS was implemented in communities that had the highest burden of malaria. And therefore we had around Upper East, Upper West, and a couple of places that had high burden. So with the initial amount of money that we had in year 1 from the Global Fund grants, we were doing Obuasi and some portions of Upper West. And then that was around Wa East and Wa West. And then in year 2, as per the screen that we have, the purple area, we were supposed to cover the entire Upper West and Upper East. And year 3, we were to cover some portions of the northern region and the rest of Upper East that joins the northern region. The red portion is the area that is supposed to be covered by the PMI intervention. That's a US President's USID intervention. So currently, having scaled down and with a profit made, would I call it a little bit of excess money that we had, not profits, a little bit of excess money that we had, we expanded to the 3 more districts in Upper East. So our current intervention area is 16 districts that covers the entire Upper West, 3 districts in Upper East, that's a Katsina, Nankana West, Busa North, and Busa South. And then in Ashanti region, we cover Obuasi Municipal and Obuasi East. As at today, Agama currently targets and spray around 160,000 structures or houses annually, protecting about 1.3 million people from malaria and creating temporary jobs that the spray men and supervisors and drivers and security for around 1,300 locals. And we also do the spraying in the prison sites. With support from the Obuasi mine, we offer indoor residual spraying in Obuasi and complement it with lava source management. And in some areas or periodically we do area spraying where when we begin to see mosquito density increasing. In some areas, it's not because these mosquitoes will transmit malaria, but at the point in time, we have so low malaria Anopheles mosquito density that when mosquito density increases, it becomes of a great concern to people in the mine and in Obuasi. So sometimes we do area spraying just to bring the mosquito density down. So beyond IRS, Agama has also been selected in the current grant under the Global Fund to do community health system strengthening within our, throughout Ghana. We are supposed to build a capacity of civil society organizations. We have about 7 networks that we have to work with them, not only under malaria, but it also extends to HIV and TB. And the capacity that is built would also ensure that these civil society organizations will be able to operate even beyond Global Fund support. And it's supposed to help build the community system beyond what Ghana Health Service, or in addition to what Ghana Health Service is doing. Our current program components, I have stated before, under the vector control, we have indoor residual spraying, larval source management, and some area spraying. Beyond the vector control, we also do what we call the keeping Obuasi clean. We have a sanitation program that mobilizes people and help them to do communal cleaning. And we also undertake entomological monitoring and other operational research. We've also embarked on social and behavioral change interventions, not only for the malaria program, but for all the other programs as well. That is sanitation and other community education that is handed over to us. We are also doing the community system strengthening that should improve the community-led monitoring for civil society organizations in Ghana. So what has been the impact so far? In the first 2 years of the program implementation, we recorded significant drop in malaria cases, 74%. And thereafter, we have been seeing some continuous drop up to 2017. Then it plateaued for a while. And in the past year or two, we have seen marginal increase, and a number of reasons accounts to that, of which various interventions have been put in place to see to it that we continue to see the decline in malaria cases. So with the confirmed malaria cases per 1,000 population between 2018 and 2023, this is what we have. We have cut off the sharp decline for Obuasi Municipal and Obuasi East, just to show the current trend, marginal increase, trying to amplify that. And then we have Obuasi East having the sinusoidal effects. It's up in 1 year and then it goes down the next year, as like that. But as I said, we are putting intervention in place to stabilize it and to even see it further going down. This is a proportion of OPD cases attributed to confirmed malaria cases for Obuasi and Obuasi East and other surrounding district. The surrounding district, as Amansia Central, Adansi North, and Adansi South, all have bed net distribution. And we can see that the proportion of the population that report at the facility with malaria is significantly lower in where IRS is being implemented than where bed nets alone is implemented. So this malaria-related mortality for children under 5 in the 5 northern zones. And as a nation, we are all seeing the reduction in malaria mortality, which is good. And we should be doing more in order to see zero malaria. This slide shows malaria prevalence for children under 5 in Upper West alone. When we began in Upper West around 2008, malaria incidence was around 51%, as mix picks it up in 2010. By 2019, this has reduced to 10.5. And in 2022, I think it went marginally up. And we are investigating to see what were the causes for this. So this slide shows the progress made with malaria control in Ghana in general. You can see that on the first Ghana map, the top was heavy with what I call it a wine with a dark color. and as the years go by, is lightening. Ghana is making significant progress. In 2011, the average prevalence for malaria was 27.5%. By 2016, it had come down to 20.6%. And by 2022, the average malaria prevalence for Ghana is 8.6%, with Greater Accra recording around 2%. So Greater Accra has the lowest malaria prevalence, and we hope to push it out as a country, we should be able to push it out for us to get zero malaria very soon. So looking into the future, as Ghana transitions from the control stage into elimination stage, the continued commitment and collaboration of all stakeholders will be crucial in achieving the goal of a malaria-free Ghana. We in Obuasi, we are advocating to add Obuasi to the districts that is earmarked for pre-elimination. And this advocacy is not just by words. We should be able to drive malaria cases below 5% prevalence, and that would enable us to be part of the national agenda and see to malaria elimination from the Obuasi municipality as well as Obuasi East. For employees at Anglo-Gold Ashanti, we are committed to the well-being of all employees and the community members in which we operate. And we recognize that each individual has a crucial role in the fight against malaria. For this year's operation, we have our theme as Small Action, Big Impact for malaria elimination. And this underscores the power of individual contributions in this collective effort, whether it's allowing our homes to be sprayed or removing mosquito breeding grounds or promoting preventive measures. Every little action by the employees or community members would provide a profound impact that we want to all see. The zero malaria agenda is not just limited to Anglo-Gold Ashanti employees or people in Obuasi, but all of us can have opportunity to do something about it. Every citizen has a role to play. If you live in an area where indoor residual spraying is being done, you would have to allow your home to be sprayed, and also encourage your neighbors to do that. If you are in the area where bed nets are provided for us to sleep under, you ensure that you do so, and also encourage your family members to consistently sleep under this. If your area also has the opportunity to experience larval source management, you provide information to those that are doing the implementation. And every individual has opportunity to also eliminate breeding grounds. In our homes, we have old ties that we are not using, barrels that we do not cover. And when water stays in these containers and it warms up, or mosquitoes have opportunity to lay eggs in, it becomes the maternity homes where we breed our own mosquitoes for them to come and bite us and give us malaria. And so we can do away with all the breeding grounds, and that will be very helpful for all of us. As a good citizen, we want to pass on malaria information. As public health people trust us with the information that we deliver. And we can leverage the trust that they have with us to influence and raise awareness about the importance of malaria prevention. We can share information and encourage our friends and families, our neighbors, to adopt positive measures that can amplify the impact of zero malaria agenda. You can be a champion by yourself. leading by example is a powerful way to drive this zero malaria agenda. Every one of us can be a champion in our own ways, from our old school gatherings, from in our churches, in our communities, during funerals. We can share information on what we can do to have zero malaria. You can start with yourself, ensuring that you do not get malaria, protect your family as a good family member, and then it moves from one family to the other. If we happen to be out during the night, it's important that we cover ourselves and also apply repellents when we have access to it. And when we feel feverish, it is important that we test before we treat. Ghanaians, we are fond of going to the pharmacy shop, buying any anti-malaria. I feel I have headache, I have some chills, and I suspect it's malaria, normal malaria, so I want to treat it. No, we should get tested first before we treat if it is positive. And when we are treating, we should ensure that we take the full prescribed medication. We can also encourage our pregnant women to go for antenatal when they are our pregnant women to go for antenatal. Normally, they'll be given SP drugs after the first trimester, and we should encourage them to take it. It will protect them and to protect the unborn child. And for children under 5, in areas where SMC, that the seasonal malaria chemo prevention is being provided, let's ensure that our children have access and take the full dose. And in areas where vaccination is being done, malaria vaccine is being rolled out, let's ensure that our family members, our children, also get vaccinated for protection against malaria. The other thing that we can do from our various companies that we work in is to encourage the private sector organizations in Ghana to invest in malaria prevention and elimination. AngloGold Ashanti is doing it. Menso Oil Palm Plantation is doing it. EcoBank is making some donation. Newmont, Goldfields, and many other organizations are doing it. If we come together, we can collectively mobilize some local resource that will help with zero malaria agenda for Ghana. I believe we can do this in our lifetime. For our association, we also have a responsibility. Malaria program is ongoing in Ghana, and I think we can do much more better. Our association can advocate for a stronger political will for malaria elimination. It shouldn't just be a burden on the shoulders of the national program, as the National Malaria Elimination Program, but we should be able to get every political party having some attachment to malaria elimination, being it part of their manifesto, ensuring that resources are made available. The president's eye is on it and is monitoring its implementation and results that are coming out. It would ensure that malaria would be eliminated within our lifetime. We can advocate for the establishment as an organization, as an association, we can advocate for the establishment of Malaria Elimination Council that reports to either the president or vice president of the republic. And the main task could be resource mobilization, monitoring progress of intervention, either on monthly or quarterly basis, and ensuring that the agenda, malaria elimination agenda, has a multi-sectorial engagement and participation. We cannot drop off the private sector, various government agencies, from the Ministry of Finance to the security, to agric, to education, to road construction, to many other government agencies and sectors can be brought on board. They all have a role to play. Each and every agency has a role to play in zero malaria. The media has a significant role to play. Academia or research has a role to play. Civil society has a significant role to play. Our chiefs and opinion leaders in our communities, they all have significant roles to play in ensuring that we have zero malaria in our country. With closing thoughts, I would say Agama program has demonstrated a significant impact that can be achieved through a comprehensive community-based approach to malaria control. If you do it well, you get significant results. As an organization coming from mining, we have come to realize that investing in the fight against malaria yields good returns on our investment. It also it also benefits the communities that we serve. There is lower absenteeism. Even school children perform well. The AGA school here is the best performing school in Ashanti region. And the community actually benefits well. Our women are able to work. Farmers are able to go to work and generate their own income and feed themselves. By working together and embracing the zero malaria starts with me mindset, we can become true champions in the fight against malaria, contributing to Ghana's goal of eliminating this preventable and treatable disease. We need stronger political will to get to zero malaria. Together, I believe we can pave the way for healthier and more prosperous communities. You can reach us through these links. And I would like to acknowledge the support that we get from the Global Fund, Anglo Gold Ashanti, that's Obuasi Mine, the significant support we have from the AGA Health Foundation that does the epidemiological monitoring for us, and Iduaprim Mine that also supports. We have significant support from the Government of Ghana, Ministry of Health, Ghana Health Service, and we collaborate a lot with the NMEP. In our area of operation, we have also had good collaboration with the municipal or district assemblies, chiefs and opinion leaders, USID, PMI, Evolve, WHO Ghana Office, Noguchi, KCCR, Navrongo Health Research, and many other institutions. Thank you, and I'll pause for your questions. Thank you, and over.
Thank you very much, Mr. Sedu, for this presentation. And for me, this is just a case study telling us how effective those interventions you've mentioned when implemented across the country will see a much important progress in our fight against malaria. Thank you very much for this presentation. At this point, we'll have room for questions and comments. And so please, if you have a question, you can raise your hand and I'll call you to speak. If your background is a bit noisy also, you can type in the chat box and we'll read it out. So it's time for question and answers. Anyone with a question can please raise his or her hand and it will be called. Okay, so before then, let me ask this question. So we know Anglo Gold Ashanti is a big company that has more resources. How do we ensure sustainability in areas that do not have much resources, like Anglo Gold Ashanti? What can you share? Thank you.
Yes, I would say Anglo Gold Ashanti is making some significant input into this. But as I alluded to earlier, we all have roles that we can play. In the first place, the NMEP has a strategy that is moving Ghana towards zero malaria. So where we do not have IRS, they have other interventions like bed nets that are being distributed. And we encourage people that when they receive the bed nets, they should put it to good use by sleeping under it consistently. And also ensuring that all family members are sleeping under that. Beyond that, I think to a large extent, we create breeding grounds around our homes. And we should look out for any stagnant water and cover it up or just take it off. We have little ponds that we create for our animals to feed in, and sometimes water can stay in it throughout the month. And it's a shallow water, it becomes a good ground for mosquitoes to breed and they come to bite. Old ties, milk tins that are around, containers that are around our homes. A good environmental management within our communities would ensure that we do that. If communities can come together and do the communal cleaning, where we can desilt gutters and any other areas that we find around. There are some small ponds. If we do not really need it, we should fill it up. And where we need it or we need to let the water flow, we can create an outlet. It flows so that it doesn't stay for us to become breeding grounds. Around our neighborhood, sometimes we have construction taking place or uncompleted houses, projects that we have in our neighborhoods, and they have some amount of water. All these areas breed mosquitoes, and mosquitoes can go as far as almost like 3 kilometers. So they can really get out of where their breeding grounds to the nearby places in search of blood meal. And that can significantly affect us. So beyond the bed nets being given, we can do some environmental management. We can do some mosquito repellents, and we can also wear protective clothing when we step out. As long as we do not get a mosquito bite, infected mosquito bites, we do not get malaria.
Okay, thank you very much. There's a question that says that my name is Andole from Accra. Please, is AngloGold ready to help facilities interested in the IRS? And will that come at a cost? If you can answer that question, please.
Right. So AngloGold is interested in expanding IRS, but our current resources gives us a scope that we can manage. We cannot cover the entire country. However, if any organization wants to invest in that, or you want it to be done, we can offer technical support, train your spray men, and we are in talk with NMEP as part of our collaboration with them, also to train various pest control organizations so that they can offer services to individual homes who may want it. In Accra, for example, a lot of people do not sleep under bed nets because prevalence is low, but some people do experience some mosquito bites here and there. And we see a number of pest control organizations that are around. We want to give them quality training so that they can provide their services for a fee that households can bear. So yes, we are ready to offer technical support.
The second part of the question was the cost component. Are you able to share that, or they must contact you before to know how much it's going to cost?
Well, how much it will cost for a home, it depends upon the available surface areas or number of rooms that the house would have. And therefore, if you contact us after this, we would be glad to share how much it will cost an individual to get this done.
Thank you very much. Dr. Mofa, you can speak.
Yes, thank you. Samuel, for this excellent presentation and the content. It's a very detailed presentation, and there's quite a deja vu for some of us. Fortunately, I was part of the team that when the former president launched it in Obuasi. I'm not sure whether I was in the picture, but I was physically present there. What's your experience? You didn't actually mention the challenge you are having with insecticide resistance. Can you just give some highlights in that area and what you are doing to address the issue? Over.
Thank you, Dr. Mofa. Dr. Mofa has really provided some significant support and still does to Agama, and we appreciate all the support. With resistance management is being a challenge. That's not the only challenge, but that is one of the significant challenges that we have had. As an organization, we want to go by the science, and therefore we use insecticides that have been approved by WHO. For the past couple of years, we have not had a lot of insecticides that have been approved, and therefore making resistance management has been a challenge. The best practice is to change the type of insecticide that you are using after every 2 rounds of spray. But normally we are not able to do that in some years. However, God being so good, last year, WHO approved new insecticides for which we can use for this year and next year. And we are also anticipating that this year, new insecticides will come on board that will help us with resistance management. But other than that, the future looks good, but previously it has been a challenge. And sometimes in some years, you have to go ahead and use insecticide for like more than 3 years, 3 years and beyond before you can have a switch. The other thing that comes with resistance management in Obuasi is the fact that for public health purposes, our use of public health insecticides are strictly monitored. However, we don't have a similar thing for the agri sector. Agri sector involves a lot of, they use a lot of insecticides on the farm. And in most cases, these producers would have previously produced insecticide with the same active ingredient for agricultural purposes. So before you even bring in the insecticide, in some cases, the active ingredient has already been on the farms for many years. And that has the ability to let the mosquitoes develop some resistance to these insecticides. So one of the things that we do is to have susceptibility tests for the new insecticide to be used under public health. And if the mosquitoes are susceptible to that, then we deploy that. But, so we've had some challenges, but this year and next 2-3 years, I think things look pretty good. And we can go with the resistance management as a country we have. Thank you, Enova. And I think you have some more answers that please feel free to also add up.
Thank you very much. There's a question in the chat box. It says, my name is Josephine. I would like to know where the implementation of the vaccination and SMC ongoing in Ghana, and how long has it been in the system in terms of vaccination, malaria vaccination? Thank you.
Right. So malaria vaccination, the research work was done in Kintampo, in and around Kintampo. And I don't have offhand the number of regions that are involved, but in the northern sector, I know SMC and some other interventions such as vaccination is ongoing. I don't have the full regions where the SMC is, so I'm not able to do that, but I can find out and let the person know later if you share your contact. If we have NMEP people on the group, you can also share the information if you have it. Thank you, and over.
Thank you very much. I'm not seeing any hands up. I'm also not seeing any more questions in the chat box. So over to you, Dr. Enim. You can give the closing remarks and then we can continue. Thank you.
All right, thanks very much, James. And thank you, Samuel, for the elaborate presentation. Let me add that Dr. Amofa is a key person in AGA malaria control programs, and he still continues to play a significant role. So thank you to Dr. Amofa. I think we have all heard what has been said. One of the things I'd like to add is that we are quite lucky in Ghana, especially to be part of a process where we are aiming to eliminate malaria. What I like about what Asiedu said was, he said, as Ghana transitions from the control stage to elimination stage, that alone gives us hope. And we all heard that we have individual contributions to make that will actually make the elimination process faster and better. WHO already has milestones towards a 2025 where there's a global malaria strategy for reduction in malaria cases and deaths. And if we all don't contribute our quota, definitely these targets might be missed. We all have a right to quality, timely, and affordable services to prevent, detect, and treat malaria. Unfortunately, this is not a reality for all. If you look at war-torn areas and others, they are unfortunate to be in a vulnerable group. So if we are lucky, let's do our part. As Ghana Public Health Association, I believe that we actually hold best the microphone to pass on the information. Let us raise awareness. Let us, by ourselves, adapt measures that contribute to the zero malaria agenda. Let us be advocates for a stronger political will. I believe as public health practitioners in our own individual spaces, if we put up the lights, definitely our voices will be heard. And together we can accelerate the fight against malaria for a more equitable world. Let us do our part. Zero malaria definitely starts with ourselves. And let us remember, small actions lead to big impact. Thank you and have a good night, everyone. Over.
Thank you very much, Dr. Enim, for moderating, and thank you so much, everyone, for joining. Hopefully, in our next webinar, we'll still share the flyer and then the link around for those of us who are ready to join us. This is still the Ghana Public Health Association. We are still open. If you want to join us, can go to our website at www.ghpha.org. You can click on the registration link and then the form will open for you to join. We appreciate your time and thank you very much. If you still want to watch the presentation, you can go to our YouTube channel and then you can also have access to it. Thank you very much, Mr. Sedu, for the presentation, and thank you all for joining. Have a good night.
For having me. Good night.
Good night.
Yeah.